The good thing in myeloma is all the drugs are very effective, certainly that have come through in the last couple of years. And what this also means is that these drugs have to go through strict reimbursement process through the regulatory authorities in the individual European countries certainly. And when this sort of data is being looked at by reimbursing authorities, they want to look at the health resource utilization when these therapies are being applied to patients. Clearly, we know that in clinical trials there are a selected group of patients, but despite the fact, what we want to see is that the therapy is not causing a decrease in quality of life. And certainly trials have now been applying these tools uniformly to try and test whether quality of life is maintained during therapy. And certainly in placebo-controlled trials we can see reliably that therapies can maintain quality of life. But reimbursers are well aware that this is actually not a real world setting, and therefore clinicians have to use these tools in the real world setting to see whether these results can be obtained. The other aspect in health resource utilization is to utilize tools such as EQ5D to see whether the utility of the health resource actually goes up or down during therapy. And these sort of tools are now routinely applied in these clinical trials, and therefore we are now able to quantify the health resource utilization when we apply these combination therapies to our patients. And this data is being routinely now published and being made available to practicing clinicians and to reimbursers.